This month we're going to talk about ergonomics and safe lifting. Ergonomics is the study of people in their working environment, and the goal of ergonomics is to eliminate discomfort and risk of injury to the worker. Ergonomics is all about differences. Everyone is made different, so we all have different height, we have different strengths, and each one of us is going to have different abilities in the work that we do. And with these differences, you'll need different designs in equipment, furniture, workstations, and routines that you do. And we need ergonomics in the workplace to help prevent repetitive injuries. Repetitive injuries are the muscle and joint stresses that are caused by doing the same work over and over. So when you have a sore muscle or you feel like you might have pulled something and it goes away in a day or two, if you keep injuring that same spot, it could build up into a more serious injury. And repetitive injuries can be caused by frequently working in ways that are going to put stress on your body, like carrying heavy loads, squatting, kneeling, gripping, working in awkward positions, bending, using vibrating equipment, applying force, working overhead, repeating movements, lifting, twisting, and overreaching. And sometimes even just a small change in tools, equipment, or maybe materials can make a big difference in preventing these repetitive injuries. A little simple change can make a big difference sometimes. When evaluating a job, look for the three main characteristics known as ergonomic stressors. And those are how much force are you going to have to do to complete the job? And what kind of working position are you going to have to be in? Is it going to be awkward? And how are you going to do that job? And the third would be, is that job repetitive? What kind of repetitive task are you going to be doing? If the job you're going to do has any ergonomic stressors, you could be at a greater risk of pain or injury. Let's take a look at some common symptoms of repetitive injuries. And they are pain, swelling, stiffness in the joints of the wrists, shoulders, and knees, and pain, tingling, and numbness in the hands and feet, and can also have weakness or clumsiness in the hands and back or neck pain. This is where ergonomics comes in. You want jobs and equipment to be designed to prevent stresses when lifting heavy objects, twisting, bending, or reaching movements. Only you can fine-tune your workstations and your work routines to prevent these repetitive injuries. So adjust the height of your chair or your stool, your workbench, your table surface, so you can work in a comfortable, relaxed position. And if you have to do a job where you stand all day, if you keep one foot slightly in front of the other with your knees slightly bent, that's going to help keep pressure off your lower back. And you can place frequently used materials close at hand and at a convenient height. That way you're not bending over or reaching repeatedly to get something. And use mechanical lifting devices to prevent back strain. And you could rotate tasks so you give your body a break to recover from doing repetitive work. And remember, your body is not a tool. You don't use your hands for pounding and your feet for kicking something into place. You let equipment and tools take that punishment, not your body.
When people hear ergonomics, they often think of this. But in truth, ergonomics is simply fitting the workplace to the worker, rather than the other way around. And that includes lots of workplaces: construction, manufacturing, transportation, healthcare. You get the idea. So today, we're going to cover some ergonomic basics that apply to virtually any workplace. These include proper posture, managing forces, and excessive repetitive motion. Ready? Let's start with posture. Sitting, standing, walking, it really doesn't matter. Proper bone and joint alignment is key. So straighten up that back, keeping ears, shoulders, and hips in a straight line. Good. Now squat by hinging at the hip. Keep everything aligned. Now sit. Perfect. Maintaining that posture through your day and work, any work, will reduce fatigue, eliminate strains. decrease stress on joints and ligaments, and have you feeling great. If posture is good, forces are evil. Why? Because they assault your posture constantly. There are lift and carry forces, grip forces, push and pull forces, and just plain old gravity. Hey, let's help you out with this. To avoid injury, don't lift, pull, or push too much. Let your posture guide you. And if need be, get help or use a hand truck or other tool. Also, move that body. If you stand up a lot for work, sit. If you've been sitting, stand up. Every change is an opportunity to realign and think about your posture. Our last Ergo 101 topic is repetitive motion. Doing the same task over and over and over and over and over well, you get the point. Repetitive motions from jobs like these can cause carpal tunnel syndrome, joint problems, poor circulation, and more. Fortunately, these injuries are easy to avoid. First, by arranging your work area to fit you and support good posture, and second, by stretching. Stretches like this, or this, or this, well, maybe not that. Every 30 to 60 minutes can make a world of difference and prevent injury. Show off. Let's recap. Ergonomics is all about fitting your work environment to you. So set up your station to support good posture. Be mindful of posture, reduce forces, and take breaks to stretch and realign yourself. Do all that, and you'll be on your way to being more efficient, more productive, and healthier. For tip sheets on setting up workstations and the Ergonomics quiz.
Now let's talk a little bit about proper lifting techniques. Before lifting, take a minute to think about what you're about to do. You want to examine the object for sharp corners, slippery spots, and some potential hazards that it could have. Know your limit and try not to exceed that. And if you need help, ask for it. And if it's possible, you might want to divide the load to make it lighter. You'd have 2 lighter loads. Know where you're going to set the item down and make sure that your pathway is free and clear of obstructions. Then follow these steps. You want to stand close to the object with your feet spread shoulder width apart, and you're going to have one foot slightly in front of the other for balance. Next, you're going to squat down, bending at your knees, not your waist. Kind of tuck your chin while keeping your back as vertical as possible. Then get a firm grip on the object before beginning to lift it. Slowly begin straightening your legs and lifting slowly. Never twist your body during this step. And once you've lifted the object, you want to keep it as close to your body as you can, because you don't want to shift the load's center of gravity away from your body, because that's going to increase the stress and could cause pain to the lumbar region of your back. And if you need to turn while you're carrying the object, you need to turn using your feet, not your torso. And if you need to put the object back down, just follow those same procedures in reverse order. And remember to keep your back as vertical as possible and bend at your knees.
You need to lift something. Let's say that something is about 1/3 of your body weight or less, up to 51 pounds. Moving it properly is easy. Simply bend at the knees, grab that something, and lift using your leg muscles. Oops! Keep it close to your body. There you go. Nicely done. Upright back, close to your body, use your legs, all excellent rules of thumb. But there are other factors to consider. These include the awkwardness of the lift, the height you'll be lifting, the distance you move the object, the frequency or repetition of the lift. In each of these cases, you should figure that you'll be able to safely lift less weight and consider other options. For example, let's say you have to lift more weight or lift it through a greater distance. You should not attempt the lift by yourself. Ouch! Instead, use a hand truck like this, or flag down a coworker like this. Good work! Or what if the lift is to the left or right of you? Even if it's fairly light in weight, twisting your spine during a lift can hurt your back. So turn toward the object nice and square. Very good. Then lift straight up. Now pivot your entire body and move the object. You're getting good at this. Here are a few more things to remember when preparing to lift. Organize storage to promote safe lifting by keeping heavy, awkward items in the power zone between shoulder and knee height. Stretch before lifting to get your muscles ready. Ensure you have solid footing and are wearing non-slip shoes. Plan your route to avoid tripping. Test the weight to be sure you can handle it alone. By lifting properly, you avoid pulling a muscle, straining your neck, or rupturing a disc in your back, which means you stay on the job, earning your full pay. Lifting right feels good, doesn't it? For tip sheets on lifting and the lifting quiz, click the link on.
If you have any questions, I'll try to answer them. Just stop by and talk to me, Mary Beth, at the lab, or call me at extension 104.